Welcome to Front Desk Best Practices. Sure, many of you might know in the past this was taught by Lynn Grattan, the shortest person at PCC, but now you get the two tallest, except for maybe Owen when he's in heels.
And they put us up high today.
Yes, so feeling very powerful up here.
So powerful.
For those of you that don't know, I'm Nick Meunier. I'm a member of the implementation team, and I'll let Lee introduce himself.
Hey, good morning. I know a lot of you by this point, but my name is Lee Gaborio. I'm one of the client advocates here at PCC. I've been here about 4 years, and just wanted to come up here and actually let myself feel short for a moment. So, yeah, Nick and I are going to work through the presentation. It's a lot of similar content than you've seen in past years, but we'll put our own little spin on it, and hopefully everybody gets something out of it. It's Friday. You made it. Is everybody awake still after last night? Did everybody have fun?
It's been a long week, folks.
Yeah, it's been a long week, but I love this week. I really do. I wish we could do it like twice a year. So anyways, I'll let Nick kick it off here. Great.
Okay. So, a couple takeaways from today's session. We're going to learn the importance of front desk best practices given by the title of this course, and we're just going to review some of those items in detail. Some of our goals for today, we're going to learn the importance of great customer service. Generating clean claims is one of the key things here. We want to increase time of service payments as well. So you're going to have to get a front desk that's not afraid to ask for money, right? This helps reduce the amount of collections after the visit. And stay busy. We're going to learn some ways to keep your front desk busy as well. So, customer service. First impressions count. Keep your front desk, you want to keep it nice, neat, and tidy. If you have a partition, don't cover it up with a bunch of papers, a bunch of flyers. It's really just kind of a barrier between you and the patient. It's bad enough we did have to go back to glass, some of us, after the pandemic. So if you did, don't fill it up with papers. Keep it nice, neat, and clean. And just to show you, here's an example of some nice, clean front desks. So shout out to Eden Park Pediatrics, which I believe is in the middle, Tamalpais Peds on the left, and Bloom's new office on the right. And as you do keep it clean, don't just have stacks of papers on the desk, as you can see as well, similar to having papers all over a partition. And next, along the same lines with customer service, we want to greet our patients immediately. It's tough to see when a front desk is too busy answering the phones rather than greeting the people that are literally right in front of them. You want to greet the people right in front of you because they're there. It's not nice to put people on hold when they're the ones that you want to actually collect money from, right? So greet them. And also just work together as a team to make sure things are happening. So, for instance, if you can't answer the phone, maybe somebody else picks it up. Or if you have a bigger practice, maybe designate one person to be on the phones one day for the day and one person greeting the patients for the day. Now, I do understand, for smaller practices, that may be a little bit tougher. Because, you may have one front desk person doing it all. But if you have the ability to be a little bit more organized as to who's answering and who's greeting patients, just to make sure that everybody is getting the same attention, whether they're calling in or they're showing up in person, that's great. Right here also, I want to mention portal scheduling. If you aren't using portal scheduling yet, certainly encourage you to look into it. If you enable portal scheduling, that will help alleviate some of the phone calls to your front desk. And if the reason you're currently not pursuing portal scheduling at the time right now, maybe due to you don't like the timing of appointments being available. Later this fall, we are going to have more customization capabilities for self-scheduling in 10.4 also. So definitely encourage you to maybe speak to your client advocate about implementing portal scheduling in your practice. And along the same lines, for phone triage, if you can, move phone triage away from your front desk. The front desk should not necessarily be triaging appointments unless you have somebody at the front desk that is either a nurse or an MA, someone with a clinical background. If you have somebody fresh out of high school, hasn't worked in an office before, they might not know how to triage patients appropriately. Also, verifying demographics. This kind of ties in to all of the clean claim stuff. Insurances and collecting money is one of the primary duties of the front desk. Also, just be the person that smiles. Being that person that smiles, it will make people more happy to give you their money. So if you can find somebody to sit at the front desk that parents love and they can collect money from those parents, keep them. I do get there are a lot of people at the front desk that may feel a little bit uncomfortable to ask for money. So you really got to find somebody that is comfortable doing so. Phones. Utilize your phone system, right? But keep it simple. So not like a banking system where you have to go through a phone tree, maybe hit 3 or 4 buttons. Just keep the list short if you're using the phone system. For instance, press 1 for appointments, 2 for referrals, 3 for billing, and 4 for a triage nurse. I've called some offices in the past where you really literally have to hit 3 or 4 buttons just to kind of get where you want to go. However, the reality of it is that people are very much, they're looking for instant gratification, right? So they may not want to sit there and go through a long list of buttons before actually getting a hold of who they're looking to speak to. But the phone systems can be a very helpful tool if you implement it correctly. Next, for phones as well, cordless headsets. How many of you here are currently using cordless headsets at your front desk? Great.
Or headsets at all.
Or headsets at all, even corded. Great. I'm sure you guys love them, right? You don't.
We tried them and everyone gave them back. They did not like them.
Okay, well.
It's just my team. They're very.
What didn't they like about them?
They don't like the earbud in the ear for one thing. When they're talking with each other, because front desk communicate a lot, so our seats are 3 across and then one like that. Picture an L shape. When you had the headsets in, it was a lot more difficult. Not as difficult, but it was easier without the headset to communicate with each other because they turn, they look, they notice.
Okay.
It was just the flow. It just didn't work for them.
No, that's fair enough. I understand everybody will have their personal preferences when it comes to that. But if you didn't like one that you tried, maybe explore some others that you might like. There's many different varieties of headsets you can use. We use them at PCC. They're great. And if you buy a good one, it'll last. It can last 10 plus years if you just purchase the right one. So definitely something worth exploring. If you tried them in the past, maybe there's another one. But yeah, having the headset keeps your hands free to do other things. All right. Also, when answering the phones, instead of saying, pediatric associates, please hold, click, and actually we don't see this that much anymore, which is great. Say something more along the lines of, thank you for calling Pediatric Associates. This is Nick. How may I help you today? Because they have a choice of going to any pediatric office, and they chose you guys. So thank them. Let them know they're important to you. And they're not just another patient, they're not just another dollar bill. Don't instantly put them on hold. If they do have some info to give you, maybe it's a little bit of a longer discussion of what's going on, you can let them know that you will put them on hold for a minute, but just don't do the instant hold. Nobody wants to be put on hold as soon as they call your office. Just give them a little bit of attention because they're reaching out to you guys. And last, regarding billing issues, of course, discuss significant billing issues in private. So sometimes it helps to have at least one billing staff member up at the front. Definitely don't discuss significant billing issues in front of other parents in the waiting room, which I'm sure nobody really does, but just wanted to make that point as well.
Thanks, Nick. I would like to point out that we didn't plan matching outfits today, but you guys are just that lucky. Maybe Zane can come hang out too. He's got the same shirt. So I'm going to chat a little bit about the pre-visit phase of the patient encounter. There's a whole set of things that happens before the visit to make sure that the visit happens, the family's on time, and then that when it's over, the next visit is scheduled and the practice is able to successfully collect the payment for the services rendered, and of course keeping those next visits scheduled to get the wells taken care of and the recurring revenue for the practice. So what happens before the patient arrives? Of course, the appointment has to get scheduled, right? Like that's the first step in the life cycle of your visits. Finding the appointment that works best for the family, and of course the practice based on both the patient and the provider needs. Appointment verification, whatever that looks like for your practice. Notify. How many in here are using Notify right now? A lot of hands. Good. How many are using Notify and pre-check-in? So you're getting twice the notifications, right? And then how many people have seen a decrease in missed appointments since going live with both Notify and pre-check-in? Fewer hands, but still some. That's great. One less missed appointment is impactful, right? And then the day prior to the appointment, we've got the eligibility verification, confirming that the insurance is, if it's not confirming that the insurance is valid. If it is not, then we know so that we can confirm we get that updated information and ultimately lead to the clean claim at the end of it. And then billing department handing your billers a tidy and accurate package to bill, get those clean claims, eliminate the back and forth with your payers and potentially with your family should there be an issue. Does everybody use the patient details screen when they're scheduling a visit, or have you removed it from your protocols? See heads shaking. If you've removed it, put it back. This screen is so important to help see that when you're working with a patient, everything is in order. You've got your appointment histories, so your schedulers may have a better clue of what times work better for your families for the next visit. You can save some of that back and forth. You've got the insurance information and all of the other pertinent information as well, balances, because now you can straight up have that conversation of, hey, you'll need to bring this payment when you come in, or you can pay it via the portal. Pre-visit scheduling. Patient details allows us to review current and past appointments, like I said, confirm those demographics and review the copays. If you have a form you want to send out to them, you can use the forms component in that pre-visit details screen and add it to their portal documents so that they have it ready when they set foot in your office and save you some time there. Or you can create a portal template and use SnapText to send a message on how to fill out that form if it's maybe a little bit more complicated. If there is no portal account, that's a great opportunity to remind them to do so. The pre-visit scheduling and the new patient process. Who's collecting the insurance information over the phone in here? Few hands, yeah. Pre-check allows, once you have that initial policy, the pre-check tool will, as if you've attended any of the other sessions, you already know this, but it allows families to upload the current cards. You get a clean image of it. The modern cards are all PDFs anyway, so they just upload it. You can have that all taken care of before they ever step foot in your office. And then if they don't have pre-check-in or the portal, remind them when you schedule the appointment to bring in their insurance and the anticipated copays that you want to collect that visit. How do you know who to call? Pre-visit appointment verifications, of course, in the portal. We have our communication preferences, and every single portal account gets set up based on what the family says that they want when they create it. Keep an eye on that, though. Watch your audience, right? I'm very text-based, but some families prefer a call. Be sensitive to that audience. What shoe fits one person may not fit the other. Meet your families where they are, not where you think they are or you want to be. You're in the service industry, right? Like, service your families too. Is the family a frequent no-show? Make sure we're reaching out to them, especially even if they confirm the appointment via pre-check or notify. Is everybody checking notify log? If you have notify, great. I have talked to people that didn't know that tool actually existed. So you're only getting half the benefit at that point. So if you've not heard back from them, and maybe they're not a phone call family, send them a text using the send text. That feature is right there in your face in the EHR. Make sure you use it for those families that it makes sense. Pre-visit appointment verifications. However you interact with them. If it's a phone call, hi, this is so-and-so from Dr. Smith's office. Reminder of your appointment on this date, at this time, at this location, for this. Also, reminder, bring your insurance card and make sure that it's valid. Portal scheduling. How many people are using portal scheduling so far? I see the same enthusiastic hands. I would love to see more next year. But that's a whole other talk. Yeah, go ahead. I got a question in the middle.
After a patient schedules on the portal, and they would say, oh, I can't make it, and they want to cancel. I will repeat again. Hi. So when a patient makes appointment or parent on the patient's portal, but then they want to cancel that appointment, they do not have that option in the portal. Will that be coming up on the next update?
I don't know the answer to that question, and I was hoping to look around the room and find somebody that built the tool.
We have Amanda from
There she
GT34.
is. Amanda.
Okay, perfect.
Okay.
Yeah.
So for those at home, the question was, if an appointment is made via the portal, can it be canceled via the portal? Our wonderful development team goddess Amanda says that it is not in the next relief, but it is scheduled for a future one.
When you add that in there, can you please make sure they can't cancel within 24 hours of the appointment?
We will definitely do our research to understand different factors.
Thank you.
So the feedback there was that if they cancel, they cannot do it within 24 hours, because certainly that's a pretty standard policy to not cancel within 24 hours, or you're subject to a cancellation fee. Yep. Yeah, of course. The people that are running portal scheduling, are we also using the report that was added to the report library to monitor it? That's really important because that allows you to keep an eye on those appointments and make sure that, like, just it plain and simple makes sense. Like the visit reason they've chosen makes sense. Giving that appointment to that family makes sense. And if you have any questions, then you can reach out to them. They were very deliberate in making sure that that was available from day one when the tool went live.
Yeah, and it's just a good way to, capture perhaps any appointments that may have come in since your office closed the previous day, just so you're aware when they're coming in and of the new appointments.
The Huddle Sheet is also a really great tool for this. Running Huddle Sheets. Is everybody using Huddle Sheets, even if you're not having a huddle? Great. Another question? Okay. I can repeat it, or Andriana too, it's fine.
Okay. So on our huddle report, when we're doing eligibility for preparing for the following day, we'll make our notes, and then we'll print that report. And the report says huddle notes, with notes, sorry. So whoever's at the front already knows what to collect for the patient that's coming in. So
Yeah.
they wouldn't have to go through all the verification for the insurance. So it's a step ahead to already know what to collect for the patient that's coming in.
Yep, that's a great idea.
That's awesome.
Yeah. So the appointment verifications, reminding them to bring their insurance card, their copay, and paying any personal balances, or they can pay ahead of time via the patient portal, and it's contactless in a very contactless world. And then you don't have to talk about money when they're standing there in front of you. Pre-visit eligibility, ensuring that the copays are right, is going to be critical in ensuring that the correct amount is collected. Just looking at it quickly and saying that the policy is active could potentially cost you money because maybe their copay went up, or conversely, maybe it went down and now you've collected too much and you've got to balance it, you've got to manage for them. Auto eligibility runs every night. Don't just accept the active, and use notes for the check-in to make sure that they appear in the check-in process. Pre-visit check-in, which I know we've briefed on already, but get your families on the portal. I have practices that are making portal use mandatory. And I know that in certain demographics and certain locations, the technology isn't always available. So what they're doing is they're actually keeping a tablet or a device in the front desk available for those families to at least use when they get to the appointment. But everybody's got a smartphone now. Make sure that they know about pre-check-in. Offer it to them. Encourage them to do it. It'll save time for everybody in the office. My daughter goes to a PCC practice. We signed on for it immediately after they started using it. Put up flyers, put it on the web page, put it on your appointment verifications, your broadcast messaging. Social media is the easiest free way to get these messages out to your families. Suggestion in the front, go ahead.
I mentioned this in another conference, but we have a fast check-in lane. So basically, we have a separate window for people who did pre-check-in.
Wow.
And it says fast pass pre-check-in patients.
It's like going to Disney.
Instead of going through the routine line where there may be one or two people waiting in line, they go right over, and we make a point to make sure that it's a quick process. They say their name, we click it and send them right to a room. So like within a minute of walking up to that desk, they're given the forms, go right to the room. People in line see it and say, hey, why did that person get to go? And we say, oh, they used pre-check-in.
Now they're a VIP.
Would you like to try this? And literally standing in line. They will.
That's amazing. So the front part of that may have gotten cut off. So she has actually got both the space and the opportunity. They've created a fast pass for those families that have done their pre-check-in to sort of skip the line, say, hi, I'm here, I'm so-and-so, and then they go and play with the little toy with the beads on it. Does everybody still have those? No? Oh, I love that thing. pre-visit data, if they don't understand what's expected and what they need to be looking for, they won't get the best data and will be uncomfortable asking for clarifications or outstanding patient. And that they being your front desk staff. Teach them basics of insurance. They don't need to be specialists, but at least have an understanding of the policies, how they work, what you take and what you don't take. That's a really important one. And then your financial policy. You make all of your family sign it. You hope that they read it. Your front desk staff should understand what they are having families sign. And then collecting those outstanding balances. And maybe you talk about this later in the slide deck, I can't remember. But when they come to your front desk, it's not, would you like to pay your balance today? It's, how would you like to pay your balance today? And then you check them in and then you can see them, right? If they have a balance, we're taking care of that before we even proceed with the visit, because otherwise that balance is likely to continue to grow. Touched on this a little bit already, but the daily huddles around the huddle sheet. Show of hands, how many actually have a daily huddle in the morning? Maybe 5%. I really like the idea. It's an opportunity to have an understanding of your families that are coming in today, talk about what's going on with them, understand their needs, talk about the kiddos. But a lot of practices I see that do them also take this as an opportunity to have a few minutes of levity in their morning. Do like a quick game, tell a stupid joke, something like that, something that just makes people enjoy that moment of their day. It's so easy for everybody to get caught up in the day-to-day grind of the incredible work that you all do. Take a moment to smile and have some fun, even if it feels silly. That's my soapbox moment. Transversely, pre-visit billing prep. Create a guide for your families to understand insurance responsibility. Make sure that the desk knows and understands that so that they can answer questions about it. Publish it on your website. And if you have questions about what other people are using, use PCC Talk. I'm going to ask another question. How many people use PCC Talk regularly? Handful of hands. How many people use it every so often? How many people have no idea what I'm talking about? Ask your client, who your client advocate is. Send them an email. Say, hey, I would like to get on PCC Talk. It is a bulletin board type where you can talk to all other PCC clients and get information, ask questions about what others are seeing, things like that. It's a really great tool. We have providers that use it all the time for crowdsourcing information, both about PCC-based stuff and just pediatrics in general. Yeah.
Yep. It's also, if you're looking for something, the question may have been asked already.
Yeah.
It's like searching through there, you probably might be able to find an answer for what you're looking for already because it's been discussed. So definitely a great resource.
I'm going to let Nick take back over.
Okay. So, same-day visits. If you're scheduling a same-day appointment, please verify that phone number. Even if you don't do it when you're scheduling future appointments, you should always grab and verify the phone number for same-day appointments. Because if that parent doesn't show up and you want to find out what's going on and you don't have an accurate phone number, you're kind of SOL. Also, real-time eligibility. It's magical. You schedule a same-day appointment and you're going to get an eligibility response. You don't have to do anything. So make sure you're getting insurance eligibility. So it's key to make sure they have insurance, because if they don't and then they leave your office, you find out it gets rejected, it's going to be harder to collect that money. And check online or via the phone with the insurance company if you need to. All right, that brings us to the day of visit. They're here. Let's check them in. So, why do patient check-in? So we got a quote up here on this slide. I'm just going to read off the slide for this one. Financial problems can be directly related to billing errors that could have been avoided simply by reviewing patient information. Errors can cause delayed payment, costly fines, and lost revenue if not caught. So, what's the #1 claim rejection that we see? And we know this because we have the data, because we submit all your claims. Demographics. Demographics needed, demographics that are no longer accurate is the #1 rejection we see. And who's updating these demographics and verifying them? Your front desk. So just make sure that they're doing this at check-in. Again, if they're answering the phones at the same time as checking in the patient, it's hard to focus on one thing when getting pulled in 2 different directions. Speaking back to deciding who's answering the phones. Also, needless to say, patient pre-check-in helps tremendously with this as well. And here we go to check them in. So for pre-check-in, you'll notice there's going to be a cool little clipboard over on the left-hand side. One is green, one is orange. Green means that somebody has verified the pre-check-in response and imported it into the EHR or denied. And orange means that the portal user completed the pre-check-in, but it still needs to be handled by somebody in your office. And with the patient check-in protocol, similar to the medical summary, you guys can customize this and determine what you want to see in it. If you don't know how to do this, speak to your CA. It's going to be under the protocol configuration tool down in the chart-wide builders section. And as you're customizing this, chat with your front desk to make sure it works for them. Make sure it aligns with their current workflow for checking in patients, because they're going to be used to doing things in a certain order, so we want to line it up in that order. And demographics, right? Ask them, has anything changed? They might think in their head nothing stands out to them, or they can't remember. So maybe something small changed. Maybe they got a new cell phone or a new email address. So be more specific when verifying, because they may not know exactly what you're referring to. They may just be thinking you're asking if they moved, or if they have a physical address change, whereas maybe their email's changed. So whatever they have set up for the patient portal is no longer valid. So would you please verify your address? What's the best phone number to reach you? Just be more specific. Get those demographics completed and verified. And day of visit portal users. So we do have the portal users component in our check-in protocol. Everyone at your practice should be able to know how to add a portal user properly. If you're checking a patient in and you come upon the patient portal users component, you notice nobody's there, now's a great time just to grab a phone number or an email address. And that's all you need to go ahead, send them a message. As soon as you sign them up, they will get that message instantaneously. So if you choose a cell phone, they may get the message right there in front of you, and you can be like, okay, now you use that link to go ahead and set up your password, because it happens instantaneously. And make sure there is a portal user linked to the billing account. A portal user linked to the billing account will be able to complete the pre-check-in process. New this year, we now have an additional component to add an additional pre-check-in recipient, where you'll be able to select another portal user to be able to complete the pre-check-in for the patient. You'll be able to select from a drop-down, which will show a list of portal users currently connected to that patient. But keep in mind, whoever set up as the additional portal user as well, they will be able to edit demographics to the billing account when completing the pre-check-in. So something to keep in mind when doing that. And manage the rest of your portal users. You're not limited to one portal user. Add both parents and add the kid if it's an older kid, giving them access to their own patient portal. And date of visit for policies. Verify the insurance information, verify the policies. Don't just look at the insurance company name, look at the actual policy itself and try to determine, has anything changed? Is this relationship still accurate? Sometimes we see folks, they'll just scan the insurance card and hand it immediately back to the parent without necessarily reviewing it. Just take a moment to review. So they may have Cigna, and they had Cigna in the past, but you can't just assume that it is the same. The ID number may have changed, or they may be working at a different company that also uses Cigna. So just be aware, since they're still on Cigna, doesn't necessarily mean nothing's changed. I know actually in the past, I think I've had my ID numbers changed on me once before. And personal balances. When checking in the patient, you'll be able to see the account balances component. Anything in red is letting you know that they owe you money. And down below, if you want to see where's that number coming from, when they ask, if you click on the flippy triangle, it'll show you exactly where those outstanding balances are coming from. So your front desk will need to know that if there's an outstanding balance, they can click on that to actually see what the balance is, because most parents certainly will ask. And also, when checking in the patient, time of service payments. This is a big one. So in the time of service payments component, you will see the expected copay and the personal balance. I'll mention the expected copay, it's going to be there regardless of visit reason, right? So your front desk will need to maybe do some thinking and be like, well, it's a well visit, so I'm not collecting a copay today. Because again, copays are linked to CPT codes, and we don't know the CPT code when we're checking in a patient always, so we have to do our best guess scenario. If it's a sick visit, we're obviously going to be collecting. Now, if they're in for a well and a sick visit was added on, perhaps they come in for a well visit, but they have a slight cough or something else going on, you can collect that at time of checkout. Because you'll always be able to access the patient check-in protocol after the patient is checked in if you use the button in the lower right-hand corner on the schedule screen. And as far as entering the payments, you put in the payment type, the amount, and hit save, and it'll post to the account. So the front desk is really the key to collecting these copays as patients check in. And that may require clear communication, right? The front desk should be trained on how to confidently and empathetically discuss payment policies and outstanding balances with parents. Offer various payment methods, including online payments through the patient portal. This can help alleviate some collection efforts afterwards. And set expectations. Instead of asking, and I think Lee was alluding to this a little bit earlier, instead of asking a parent if they want to pay, staff should set the expectation that payment is required. And if they say, oh, I can't pay $300 today, work with them. Well, how much can you pay? Because some is better than none. And if your front desk is uncomfortable, get them comfortable, right? Your front desk really is kind of your sales force. They have the ability to drive revenue for your practice. It's a very important part of your job. Collecting personal balances can be a pain, just ask PEDS 1, but it is something necessary that needs to happen for the health of your business. and copays and high deductible plans. So for people with high deductible plans, I've seen some practices collect that money up front. If you are doing this, and I've seen it more and more, they have a high deductible health plan. The front desk may collect a little bit more money than what they're probably going to have left as a coinsurance, but again, it's easier to give money back than it is to collect. If you collect $100 for a sick visit and the personal responsibility is only $92, you can write them a check for the rest, or it can go against their next copay. If you're not collecting the money, have a credit card on file policy, right? I've seen more and more practices establish a credit card on file policy these days as well. And this can, for example, this can include verbiage such as, after it's gone through insurance, if there is a personal balance, we will send a message to charge your card in a couple days. Or some will simply say, when we get your personal responsibility, we will charge your credit card on file. I understand this. If you have a high, for instance, Medicaid population, you may not be doing it. But does anybody have a credit card on file policy right now? Great. If you're not, think about it. It might be something exploring and perhaps building into your financial policy, right? Yes.
Is your credit card policy, optional or mandatory?
Ours is mandatory for new patients, optional for existing, unless they previously had a collection issue.
So apparently the microphone wasn't on. The question was, Fridays, right? Question was if the credit card on file policy was optional or mandatory. And I didn't hear the response.
For me, yeah, for mine, it's all new patients, it's mandatory. And then if your balance goes greater than 90 days, it's mandatory. But if you're someone who pays within 30 days or whatever.
So the example given was that for,
And we call it auto pay, we don't call it credit card on file. Yep. And
Yeah.
I actually, believe it or not, psychologically, people are much more receptive because they're familiar with the term auto pay.
Yeah.
So we tell them auto
that's how I make
That-
a mortgage. So the policy given was that all new patients give a credit card on file, and any family with a balance greater than 90 days must keep a card on file for future visits. But if they're within the 30-day policy, they're allowed to keep it the way it is. And she calls it auto pay instead of credit card on file, which is a little more user-friendly. That's how that's how we pay our car payments and our mortgages, right?
I wanted to let you all know that there is a lot of questions in the chat, but specifically regarding the what we're talking about right now is we can't always tell by looking at a card or in the verification process that it is a high deductible plan. How are other people determining whether the patient has a high deductible to know to collect more money at check-in for the appointment?
Yeah, so
Eligibility.
when you run insurance eligibility, there will be, another flippy triangle. You can see the full report of eligibility. Typically in there, you'll find the more minute details of the health plan, and you'll be able to determine whether it's a high deductible plan or not. Any other questions in the chat?
There is one more in the chat regarding autopay. Will they be dismissed if they don't agree with autopay?
It depends, do they have it on, we don't take on a patient. So because it's part of a new patient policy, they don't come into our practice if they don't agree with that. That's just the terms. For other people, we offer them auto pay, But at the point where your balance has gone 90 days and we're starting a collection process, if you want to remain with our practice, you've already shown that we may have to expend a little more effort to get that. And we want to avoid that conflict in the future.
We also have in our policy a $30 rebilling fee. So that's another way for them to also leave auto pay.
There aren't many
Great.
other industries where you walk out the door without paying for it. So
I also think that it makes it easier to collect co-pays, having a credit card on file. They're more apt to say, yeah, just, you have a credit card on file, would you like to pay? Or, you know, and it's much smoother, I think, you know.
It's also good for the classic divorced parents. Dad's responsible for copays. That's wonderful. Have Dad add the copay on file, and we can charge it each time.
Awesome.
anything else, Andriana? Nothing now.
I feel like a lot of these are
Did
going
we
back in
miss- we
time a
missed
little.
some?
So we'll
We
have,
can revisit them at the end if there's time.
that's
Yep,
great.
we got questions at the end, for sure. Yes.
Two things. How do you handle expired cards?
So we have a demographic.
How do you handle expired cards?
We actually created in the demographic fields for the account, there's one that says CC, and it has the last 4 digits of the credit card, and then expir date, and it has the expiration date, because parents will say, well, which credit card do you have on file? Which one are you charging? This way they could read the last 4 digits, and if it's expired, they know when they're checking in, oh, I see your credit card on file is expired. Would you like to update that?
And then secondly, do you have a limit on which you will only charge X amount of dollars? I mean, if they've got an $1,800 balance, are you charging $1,800, or do you give them a max and we'll spread that out over a couple months?
But good question, good question. Actually, we have an allow 30-day policy, so the credit card does not get charged right away. The credit card, they have 30 days. We do a statement that day. It goes out. If the patient decides that they want to pay it, they can send it in on an alternate payment. They can call the billing office, but they know that will be charged on the 31st day, unless they reach out to us and say, you know what, not that. Now, if it's something like an 1,800 balance, which I have had as a newborn, we will send them a portal message and say, on Friday, your card will be charged X amount. Please contact us if, you know, because I don't want somebody's mortgage to bounce because, you know.
And what do you do if it's not authorized?
What do you mean by not off? I'm sorry, if it's not.
If the
it
card
goes
is
through.
out.
If they don't,
Credit limit. You can't charge it on the card.
We'll keep doing it in increments until we can hit whatever that amount. Let's say they have a $900 left. We'll charge the 900 and then we'll send them a note that they still owe the remaining 9.
We can also give the option to do a payment plan for that balance. So let's say you charge the 900 and the rest can go towards a payment plan.
Separately, if you're not aware of it, there's a new federal law about payment plans and how they're calculated. So it just went into effect July 23rd, or it goes into effect.
cool. Anybody got anything else before we move along? All right. So, yes, credit card on file. You have to get authorization. It can be part of your financial policy. And as you guys have done, you can determine who it applies to. Does it apply to all patients? Does it apply to new patients? Or does it only apply to those with high deductible health plans? That's entirely up to you. And just a reminder, don't put their whole credit card number in the EHR. Your merchant services company may have a place they can store it. I know if you're doing portal payments, they can store it online as well. And track the copays collected. Have the front desk staff track the payments made and the payments not made. And if they're tracking the payments not made, try to track why it wasn't made, right? Somebody says, I forgot my wallet. Have them pay on the portal. Consider a billing fee. As you said, if copay is not paid at time of service. I'll mention the legalities around this do vary state to state. So if you want to do this, check your state regulations. And lastly, don't waive copays. It's illegal. If it's in your financial policy to waive for hardship, then that's fine. But in general, don't waive the copays. And day of visit, check out. Schedule the next appointment. Look at the missed appointments, count for all visits, improving out. These are the next few things we're going to cover. So schedule that next appointment at checkout. To do this, you're going to want to make sure that your appointment book is at least 6 months out for younger children. However, we encourage you to build your appointment book and your provider hours 13 months out. Why? That way, when they come to schedule that next well in a year, you have hours on the schedule a year from now already. No need to force an appointment. And they should know your well visit schedule, and the front desk should focus on scheduling well visits. Going back to that, we do have this component in the EHR that your front desk should be aware of, recent and upcoming appointments. It will give them an idea of when the next physical is due based on the charge for the last physical they had. And this is always found at the top of the medical summary. And in the appointment book, when you're actually scheduling that next visit, the appointment book has some smarts built into it. You know, we have different increments, 2 weeks, 1 month, 3 months, 6 months, 12 months. But of course, if you're somebody scheduling, you might already know the shorthand that if you want to schedule something in 5 months, you could put 5M, 3 weeks, 3W. So we made it a little bit easier to find those appointments when you're scheduling at checkout. And that brings us to the end of the day.
Me again, sorry.
This guy.
So the first thing to talk about is tracking the missed appointments, making sure that you know who didn't show up for the day, whether that means marking them missed during the day. Some practices wait until the end of the day. Either is fine as long as it gets done. Question, how many charge a missed appointment fee in the office? I expect a lot of hands. I got about half. It's actually less. Okay, there's a few more. How many collect them? You get them because you don't see them again until they pay, right? $50. Yeah, that's lost revenue, right? You know, you're losing revenue. You're losing time where you could be taking care of another family who may need you. Yep. Is it the same for a sick and a well? You're just 50 across the board? And is anybody different? Yeah. Which is more? I don't know the answer to this. Wells or more? Okay. Do you know that missed appointment fees aren't really shown to keep people from missing appointments? It's not a super effective deterrent, we find. Patient notifications are really the most effective method. Some families require a little bit more engagement, as we know. It could be a notify message and a phone call and a text, but missing those appointments is a big deal. Tracking them, make sure it's part of your financial policy, and the front desk knows that. When you have somebody who didn't show up, are you then following up with the people who didn't show up? And yeah, how many? So when they don't show up and then they answer the phone and they say, my car wouldn't start, or something like, we all have lives, things happen, unfortunately. Is everybody, I hope, a little bit of leniency depending on what's going on. If they're eager to reschedule the appointment the next day, maybe, my cat died, right? Yeah, read the room, figure out the family. You guys all know your families. I got a question over here. Yeah, let me mosey over. Don't be sorry.
So I'm curious to know like what other practices are doing in regards to missed appointments. In my heart, I hate discharging patients and families because I've been there for so long and I know the struggles. But there's like a limit. So we have certain families that will miss 3 appointments in a row. I'll give them a warning that, they may have to find a new pediatrician, but I feel bad and I won't actually follow through. So like what policies are other people implementing when it comes to several missed appointments in a row?
Going back over here.
We give them 3 in a year. If you miss 3 in a year, you get a first letter, a second letter, and a third letter and saying, you're dismissed. We'll see you for 30 days for illness, and then you're dismissed, just like on the collection side. Not 3 in a row. I mean, and it's 3 per family in a year. So if they've got 3 kids and they've missed a double and then a single later on, that's 3 and they're done. Yeah, it's 2 appointment times. So.
Right, Andrew, go.
We similarly have that policy, but we have a breakdown because we do have 2 behavioral health specialists in our office. They have a different policy. So we found that our behavioral health specialists, because they're seeing them on such a weekly basis, and they're treating them like specifically for crisis and or behavioral health issues that might make them not have a good concept of time, they need a bit more leniency. So for them, we're not going to kick you out because your family's in crisis and you can't make it to your visit. They get a little extra. They go on like a probationary period if they meet their max in there. And it's like, you know what? We'll give you resources to find another place to help you. You can come back in 6 months if you can recommit to this. So that's what we did for them. For all the other regular medical visits, it's a rolling calendar. So the day that you have your first missed visit, that one will not bump off of your family's account as a missed appointment until next year on that day. And similarly, it's for the whole family, not for just one patient. So 1-time grace, 2nd-time fee, 3rd-time dismissal, 30 days you're out.
That's great. Behavioral health or not in the practice, you're all seeing families who go through crises, right? Like it's important to be understanding of that. So yeah, connecting with the family, if they don't connect, then certainly you're more eager to say, maybe this isn't working, maybe it's time you find another provider, or maybe they've moved, or who knows. But at the end of the day, we need to account for all the visits, make sure that everybody's been checked in, verify there's nobody left on the schedule tab. Make sure there's nobody left in your patient rooms either, by the way. I have heard about this happening, and it's mortifying.
I will say, I've seen practices use that. They'll keep a patient in that checkout status on the schedule screen until the room is actually cleaned. So that could help avoid that.
Proving out payment reconciliation. Every person that takes money somehow in the practice needs to follow this process. Everybody using the payment reconciliation report, I don't want to see a single hand that is you're not. Good. Oh, we're going to talk, Juliana. Oh, okay. Okay. I was like, I know I just met you, but come on. Yeah, one comment from the front here. One sec. Oh, thank you, Andriana.
So since sometimes we have 3 front desk during the day, so when each staff member goes to lunch, they have to do a reconciliation of the morning, and also before the last person leaves at the afternoon, they also have to do the same.
So you're doing 2 a day.
Yes,
Wow.
because sometimes, yeah,
How many patients a day do you see? I'm just curious.
probably 40.
Okay.
Just because sometimes you collect the payment, but it's not posted. So if you don't do that reconciliation, the day will pass, maybe the next week, and if you don't have someone who's doing that reconciliation at the end of the week, you're gonna miss that payment, and it's gonna have a balance when they really don't have a balance.
We actually do it 3. So we do it at lunchtime, an hour before your shift ends, so that if there's an error, you can catch it.
Gives you
Same
gives you
and
some
then
time to
leave.
fix it before the end of the day. That's great. Better more than less. Show of hands, who takes cash in the practices? I'm not going to come rob you. I'm just curious. Okay. Does every person that takes cash have their own cash drawer? Yeah? No? It's something to consider, because now all of that communal cash makes it really difficult to find where the error came from. Compartmentalizing it by user, now you know where to look.
For those at home, it was about 3/4 of the people in the room.
Yeah. Yeah, it was actually, that was more hands than I expected. Also, don't keep it where it's accessible from the other side of the desk, because I suspect that those of you who take cash don't have an actual cash register. You just have a drawer or a cash box somewhere, right? Yeah. Protect it. Again, some of our families may be in a crisis. You never know. Should balance themselves, make sure the money gets counted, and then use your payment services, your Blue Pay or whatever you're using to balance out the remainder of it. That employee doesn't go until it balances is my stance on that.
There shouldn't be, yeah, is my mic? Nope, we're good. There shouldn't be any downtime at the front desk. You know, if things slow down, work on recall lists. Call patients for overdue well visits, asthma checkups, ADHD checkups, flu shots, whatever can bring people into the door. Recalling patients is such a huge thing for driving revenue at your practice, right? Your front desk is a sales force. Calling people is not easy. So if you can, think of ways to perhaps incentivize them, right? And this doesn't necessarily mean monetarily. Perhaps somebody who makes the most calls or sets the most appointments gets a Starbucks gift card, or they get to leave early on Friday. Whatever works to motivate people, explore it.
That's calls on the office phone, not their cell phones. Just not calling friends.
And if you are going to incentivize them, obviously you're going to want to track these things. Track how much recall they're doing. Track the copay collection rates. Track collections for past due balances. Track KPIs for phone notes, portal messages, and then again, set goals or rewards for staff that are doing these things. And just to review, some of the things we really want to take away from today is we want great customer service up at the front desk, right? Greet them immediately, answer the phone, thanking them for calling. They chose your practice. They could have gone anywhere. And generate clean claims from a demographic standpoint, right? collecting and verifying demographics, at least, is one of the things that you have control over when submitting claims. Increase the time of service payments, right? Set the expectation that they are paying today, right? Don't ask, do you want to pay your balance today? Ask them, be more specific. Do you want to put this, would you like to put this on a credit card today? That'll get them reaching their back pocket, pulling out their HSA card, their credit card, whatever they want to use. But at least it sets the expectation that they're paying something today. This is going to reduce the amount of collections after the visit. Establish who's going to answer the phones, right? Have somebody designated to phones or rotate it around. But either way, have somebody greeting the patients, somebody answering the phones. And maybe with a nice cordless headset. And stay busy. There's always things you can do, especially in the way of recalling patients, bringing revenue in the door. Next, a reference from the one quote I had on that slide. But it brings us to questions. Andriana, I believe you have a list of questions in the chat.
I absolutely do. Okay, to start a little bit further back, from Michelle, are there plans to add the PCP to the insurance eligibility? We love when we are scheduling, you can see if the insurance is active. We need to also be able to see if the patient is assigned to our office, especially for Medicaid patients.
I feel like I've seen it in the eligibility report.
Zane is nodding.
It depends on the payer, what they give back to us in that report. Because what comes back in that eligibility report isn't necessarily something that we're building. That's what we get from the payers themselves.
My advice for Michelle would be if she has an example to reach out to support and or the billing team and see if maybe we can figure out why that's not coming through.
All right. And from Talia, copay related, would Apple Pay or Google Pay ever be an option in the portal?
I think Portal Payments uses.
No, I don't think it does.
Stand
Apple
corrected.
Pay.
I see Amanda shaking her head.
Ask James. No.
Yeah.
Right now, we're
Yeah,
using,
that's.
Payment Pros.
Yep.
Yep.
Payments, and is it in the works, maybe integrating like CardPoint, where we have a lot of our credit cards on files, and having them go right into?
So I'm inclined to
PCC
say
account.
no. I think we like keeping the financial information out of the EHR and using trusted services like Payment Pros and James and Sarah. They're wonderful and people that do similar work.
Yeah, but if you do a payment, say, on their credit card,
Yep.
say CardPoint, you have to go and manually put that into.
That's true.
Yeah, and it would be nice to, because mistakes happen when there's more than one step to do something.
Yes.
You know what I mean? So it would be nice to have it integrated, so.
Yeah, I
That's
think
one of my wishing well things.
Yes, I know
there's
there's definitely a wish out there for
we've
that.
heard it. Yeah,
'cause
I
you got
think the sake of keeping financial info out of the EHR is the bigger priority for us at this point.
But auto post of that payment, how is that different than auto post from a draft, an ACH?
I think what he's referring to is when you collect the payment at time of check-in, you're going to swipe the card on your merchant
Credit.
services system, but then you have to manually input it into that time of service component in the EHR and hit save payment. And I think
Portal payments.
No, not talking about portal payments, no.
Okay.
One of the reasons is that you don't have credit card on file, do you? Or you do? Okay. Well, we do, but it's with a separate company, so it's not integrated. Yeah, yeah.
That was regarding
Yeah.
third-party companies being integrated in the EHR. To clarify, such as CardPoint.
Andrew, on the next question.
Okay, let's see. Okay, from Eleanor, pardon me. Is auto eligibility an automatic feature? Oh, and I believe I might have resolved that one. Hold on. Oh, yeah, actually, no, this is good to say out loud, actually. Is auto eligibility an automatic feature, or do we need to request that?
No, you'll get our eligibility tool with the EHR.
Yep, I think the billing team configures that at Go Live.
Our EDI team will configure that and gets it all set up for your go live.
Great. And then going back to FastPass. FastPass sounds like a great idea, but do you still collect co-payment at check-in?
Usually, most people with FastPass are the well visits that you're not doing it on.
And also, will they be dismissed if they don't agree to autopay?
Once again, the auto pay applies to patients who have a balance that have gone over 90 days. You've already established that you're a financial risk for our practice, and new patients.
Thank you.
Oh, I've got a real hand in the back. Let me make my way.
There you
over
go.
there.
Run.
Get my steps in.
Do y'all take people back after they've gone to collections, ever? Case by case? Okay. If they pay collections, of course.
Once you send that letter of dismissal, and then they tried to call to schedule an appointment, and they've been ignoring the pile of stress letters in their house, yeah. And now they have to confront, like, oh, shoot, I can't see my doctor now because I never paid that. We don't have to deal with a collections company. We deal with it in-house. So we tell them, well, I'll have to let you speak to the billing office. They might let you back in. And then they tell them, yeah, pay it in full. We'll give you grace. We'll let you back. Of course, there are some families who do this over and over and over again. But over and over and over again, we finally get our payment in full.
We have some that after letters and calls and portal messages and voicemails, they just won't do it. And we have sent them to an outside collection agency, so we don't get that full payment back. So we've let them back in the past, maybe 2 strikes and you're out.
You can get that collection fee back. Don't let them come back until they pay the collection fee. Make it part of your financial policy. And then set them up for credit card on file.
The collection company keeps the portion.
Charge the patient. Charge the patient the collection fee.
So they get like 1.5 times the fee.
Whatever the fee is, make yourself whole before you let them come back.
It's great dialogue. Well, another in real life question or comment.
It's just a comment. This is Zane at Peds One. If this is going back to the patient check-in and what to have on your screen when you're checking the man or doing pre-check-in or scheduling, put your account notes on that screen and ensure that your billers are using those account notes for anything that may be relevant for your front desk rather than those eligibility notes. Anyone can change those eligibility notes at any time. They don't stay there. They're not permanent. Use your account notes there for anything that the front desk may need to see. Oh, this person's having an eligibility issue. They're having a coordination of benefits issue. They're still not eligible for their insurance as a newborn. We talked to mom. They said they're working on it. They don't have the birth certificate yet. It's going to be 60 days. Whatever's relevant to your front desk as a biller, put in those notes and make sure that those notes are visible to them. And on the other side, your front desk can put those notes that may be relevant to your billers. Oh, we saw their PCP wasn't updated. We asked them to update their PCP. we had them update their coordination of benefits over the phone when they were coming to check in. It creates really good dialogue between your front desk and your billing department to have that there and for them to be able to add those notes and read those notes. And everyone will thank you.
Yes, absolutely.
Thanks,
So,
Sam.
if you are an older practice and you're not utilizing that account notes component yet, add it into anywhere that may be relevant with account information, billing information. Can be done through the protocol config tool.
I just have another suggestion, sorry.
Yes.
We have a biller who runs the upcoming appointments for the week, and she runs the balances, and it'll pick up credits as well as patient due balances. And she calls the people before they come in for their appointment and say, oh, we see you're coming in, just confirming you're coming in Thursday. I see you have a balance. Would you like to take care of that today instead of taking care of it when you check in? Can I say it's successful 100% of the time? No, but what does it do? It opens the dialogue to questions about the balance. So the biller can say, oh, I see that balance is for coordination of benefits. Did you ever call the insurance company? You know, those types of things. So if nothing else, whether you get the payment or not, it makes it easier for your billers to work those balances that are true, like insurance balances. And we can collect payments ahead of time.
Actually, I have a question for you. You had mentioned about a new federal law.
I looked it up, I'm sorry, it applies to New Jersey. I apologize, I misspoke. That is for New Jersey only. So it's a New Jersey law.
She's like, good. Everyone else is sweating.
Yeah, I know, everybody else is sweating. Sorry, guys.
And then, can you collect a collection fee if they have Medicaid? Like maybe they did not have Medicaid before, but they do now. Would you still charge them for a collection fee?
It's based on the data survey.
Probably time of service and maybe the effective date of the Medicaid policy.
And any other questions in the chat? If I have not responded, since there was so much great discussion within the chat itself, feel free to re-ask if I have missed you.
Anything else in here?
Anybody want to make Lee run across the room one more time?
Genuinely want to thank you all for being away from your homes and your families this week. I hope you've all had a great time and everybody has a safe trip home too. I know we still have some time left, but this is my last time to talk to you.
Time left. Thank you all for coming today. Great to see you.
Maybe another one.
Can I ask one
Go
silly
ahead.
question? I just want to see what other practices do. I don't know if you ever have a patient that either you discharge from your practice and they just show up. Like, we have walk-in hours, but let's just say they show up and want to be seen after you've discharged them. What do you instruct your front desk? I mean, obviously, they come in bleeding. You're going to see them anyway, but just kind of curious how other practices handle that.
Are you within the 30 days? Outside of the
There we
30
go.
days, if you see them and they're bleeding, you've reestablished that relationship again. So you have to be really careful if you want to do that.
In good conscience, how do you turn away a child who's bleeding or in respiratory distress? I feel like the doctors themselves have an ethical, if it's emergency, if it's a well visit or something like that.
Emergency in your office?
Yeah.
Yes.
Yes.
Can you handle a respiratory? Can you handle, do you stitch? Do you do all those things?
Yes.
Then you reestablish that relationship.
And then we restart.
I'd like to know how you do it. I'd like to know how you do it when you have a missed visit, or excuse, a missed visit fee, and they want to come in and they're sick, and you won't, it's the same situation. Do you see them?
Once again, it all goes back to what are they here for? If it's an emergency, if it's an ear infection, if it's strep, you know.
Did I misunderstand
Yeah.
what you said, that you won't see them again, you won't schedule them again?
We won't schedule them again. So if they have a balance, we make, when they call in, we will make arrangements on the balance. And if they walk in as well, the billers will go in the room, get a credit card if they're not already on it, which most of them do. Our biggest challenge is expired credit cards, or I don't know if any of you guys have seen this. It was really big on social media. You go, you buy a gift card, and then you've seen this? Yeah. We've had a couple of, they buy like a Visa gift card, use that as your credit card on file, and that's when you find out it doesn't work.
I've got another video over here, too.
So we don't have a walk-in clinic, so I can't really say what we would do in that situation. But we flag people for different types of dismissal. So if somebody's trying to reestablish and they were dismissed for no-show policy or dismissed for balance, they're going to speak to a manager. For no-show policy, if it's been like several years, maybe they have a different guardian now, maybe there's been like a change in custodianship, we'll reconsider and give them a second chance with knowledge ahead of time. Like, you have a one-time chance. If you miss any other visits, you're dismissed again with no more chances. For people who it's for balances, pay us back and we'll let you in. And then the last kind of dismissal flag we have is called a no tolerance. The no tolerance is behavior issues. If someone threatened my staff, if they cussed us out, if they were rude to anyone, like other patients or things like that, in that dismissal letter, we don't only say you're dismissed, all of that. We work with local police and we flag their account, call the police if this person steps back foot on the property. And in the dismissal letter, it clearly states you are no longer to contact the office or step foot on property, or police will be called to escort you away. And so our front desk knows to call the police in those situations.
That's great input. Thank you.
That's great. I actually haven't seen that yet.
Anybody else? We have until noon, but you
Yeah.
have a little back of your day to pursue your passions.
All right. Well, thank you all for attending this with us.
Thanks, guys.